Hello, welcome back to the channel. Don't forget to subscribe and like so that when there are new material, you can be notified. So let's continue where we left off in our study of pharmacology as we looking at pharmacokinetics. We began looking at the first principle of pharmacokinetics, which is absorption. Now today we want to look at the processes of absorption and see how the drug is able to move across the biological barrier. Remember, we said that absorption is the movement of the drug from the site of administration across a biological membrane to the blood. Once it gets to the blood, absorption has finished its job. But how is the drug able to cross the biological barrier? And that is what we mean by the processes of absorption. Two main processes or two main types are available. We have the passive process of the passive transport and the active transport. As the names indicate, passive means there's no use of energy, and active means there is the use of energy. In other words, when a drug or any substance is crossing a biological membrane, the drug can cross by a passive transportation method or by an active, meaning the cell will utilize energy in the form of ATP, adenosine triphosphate, ATP, to cross the barrier. So let's start with the first one, passive transportation. Passive transportation. When we talk about passive transportation, like we stated here, we are not using energy. And there are two main forms that we look at. Simple diffusion. Now, when we say simple diffusion, it simply means that the drug is moving across the barrier simply from a higher concentration area to a lower concentration area. Now, this is the method by which most drugs are absorbed into blood circulation. With the exception of only a few drugs, most drugs are absorbed or most drugs are transported across biological barrier by the simple diffusion method. Simply meaning when the drug is applied at the point of administration, the concentration of the drug at that point or that area is high. And then the drug from that high concentration moves across the barrier to the bloodstream. So simple diffusion. Now, it's important to note that if you look at our barrier, it is primarily lipid in nature. So if you look at the picture to our right here, you see that this is outside of the cell and it is lipid here. Inside of the cell, it is also lipid. So this barrier, which is our cell wall, is said to be a bilayer, a lipid bilayer. So the drug has to cross this barrier. And because it is lipid in nature, drugs that are lipid are those that are able to cross by this simple diffusion method. In other words, only lipid-soluble substances can diffuse across the biological barrier, the lipid layer of the biological barrier, which means if our drug is a water-soluble one, it requires another method. It will not simply diffuse across the barrier. It cannot diffuse across the barrier. Because of that, most drugs are designed to be lipid in nature so that this activity or this barrier can be overcome. So that is the first type of passive transportation method, and it is the simple diffusion method. We also have what is called the facilitated diffusion method. Now, this accounts for a smaller portion compared to simple diffusion, which accounts for most of the drug's method of crossing. Now, when we talk about facilitated, as the name indicates, there is a cell that is going to facilitate, help the drug to cross. So, in this case, the drug, and it's a diffusion, so it's also going to be from a higher concentration to an area of lower concentration. But this time, a molecule is going to serve as the facilitator. A transport molecule is going to serve as the facilitator. So in other words, when we say facilitated diffusion, we are still moving from an area of high concentration to an area of low concentration, but this time with the help of a transport molecule, and the transport molecule becomes the facilitator. So if you look at it in our picture here, you will notice that this facilitated and simple diffusion are both passive transport methods. The difference is that in simple diffusion, there is no molecule to help the movement of the agent, but in facilitated, there is always a molecule, a transport molecule, and you can see various forms. This is a channel type, and this is a carrier type, but both molecules are aiders. They are the facilitators to help our diffusion, which means we are moving from higher concentration to a lower concentration. So that is the first process or the first method by which drugs are able to be absorbed across the biological barrier. The second method or the second way is through an active transport, where we are saying we are using energy. So in this case, the cell is, or the agent, the drug, is going to move across the biological barrier, but this time is going to move from an area of low concentration to an area of high concentration, which means it's going to go against the concentration gradient. And because it's going against concentration gradient, there is always the need for energy. So usually, this form of transport uses energy. And the energy that is used, cell's energy, is ATP, adenosine triphosphate. So active transportation is where the drug moves across the barrier from an area of low concentration to an area of high concentration against the concentration gradient using energy. Like our simple or our passive transportation, there are also types of our active transportation. So let's look at the types of active transportation. The first type of active transportation is the primary active transportation. And primary because in this case, we are using the energy directly. So when we say primary active transportation, it is an active transportation where the energy is directly used to transport the molecule. In other words, there's no mediation between the energy and the molecule. The molecule uses, the energy is used directly to transport the molecule across the cell. So, for example, you take a sodium-potassium ATPase. This is a transport molecule that uses energy, and it uses energy to move sodium ions out of cells and move potassium ions into cells. So it moves, and usually that means that sodium concentration in the cell are going to be more. Outside the cell are going to be more than inside the cell. So we're going to move from that higher concentration to a lower concentration. So that means energy is required to move the sodium ion, which is in lower concentration inside the cell, outside the cell, and therefore energy is used. And potassium ions, which are of higher concentration, are also moved against the, so on the outside, potassium is lower, on the inside, sodium is higher, and on the outside, sodium is lower, and the inside, potassium is higher. And we move across in that order against the concentration gradient where we are using energy. And the transporter is known as the sodium-potassium pump. This is an example of a primary active transport where the channel directly utilizes the energy, to do the movement. So you look at this and you notice that here we have our agent in lower concentration and we are moving it to a higher concentration. So the energy is required to transport it. Now, this is a co-transporter where two agents could be moved in that same order, but like our sodium-potassium pump that we just discussed, here we are moving one from a lower concentration to a higher concentration, from the inside of the cell to the outside of the cell, and we are moving one from a lower concentration to a higher concentration into the cell, a form of exchange, This is primary active transportation. Then we have the secondary active transportation. Now, in the situation or the case of a secondary active transportation, the energy is not utilized directly, but it is utilized indirectly. In other words, it is going to be relying on the gradient that is generated by the primary active transportation method. So when we talk about secondary active transport, it simply means that the energy is not directly used by the transporter, but it is indirectly used. So let's look at some examples. We look at a symport or a co-transporter, a symport. Now, if you look at it, both ions, so here we come back to our symport here, and we notice that sodium ion is our example we are using here. And let's say chloride ion are both being moved in the same direction so that you can have a sodium-potassium symporter, meaning that both ions are moving from a region of lower concentration to a region of higher concentration, utilizing energy. But the energy is indirect, not direct. Another example is the glucose-sodium symporter. Then we have another example, which is the antiport, or which is a counter transporter. Now, in this case, we are moving ion in one direction, and the molecule, the transported molecule, is moving in the opposite direction. So this is kind of like an exchanger. So that's why it is anti, the opposite, counter, so that the ion that is driving the movement is moving in one direction, and the molecule that is required, that needs to be transported, is moving in the opposite direction. And here too, we are using energy, but indirectly. Energy, but indirectly. So that is secondary active transport. All right. Now, there are also some specialized type of transportation methods which are rarely used but are also used in the system. Now, these ones we will call the bulk transport methods. The bulk transport method. And this is usually used when the molecules or the items being transported, the drugs, are in large quantities. So then they are put inside a vesicle and they move either across the cell, into the cell, or outside of the cell. So in this case, we will have endocytosis. Endo means into, cell, cyto is cell, so into the cell. So endocytosis is where a cell is taking in a large quantity of substance in the form of a vesicle in engulfing it, or I like to say swallowing it. So if you look at our picture here, you'll notice that this is a large molecule and the cell is engulfing it and swallowing it. So this is what we refer to as endocytosis. Endocytosis. And there are various examples of endocytosis. We have phagocytosis, which described as cell eating, where the cell engulfs particles as if it is eating. And then we have the pinocytosis. In this case, it is drinking. The cell is drinking. So it is fluids that are taken in. So we call it pinocytosis. Then we also have receptor-mediated endocytosis. In this case, a receptor, a specific receptor, is what takes the substance into the cell. So that is all forms of endocytosis. Then we have exocytosis, which is the exact opposite of endocytosis, where the substance or the molecule is moving out of the cell in the form of a vesicle. So here the cell is spitting, if you like, is bringing out the molecule outside of the cell. So here the cell is expelling materials via the same vesicle out of itself. And that is exocytosis. Now, these are described as bulk transport methods. Bulk transport methods. Usually, this is not used in drugs, but it can be used depending on some factors. All right. So let's look at all of that in, let's say, the GI tract. So now this is your GI tract. These are the villi in the small intestines or the large intestines. So now you have your intestine here, and then you have your villi, and you have taken your drug or swallowed the drug as we saw the other time. And the drug can go across by a passive transportation method or by an active transportation method. If it is a passive transportation method, it means we are not utilizing energy, and it can be a simple form or it can be a facilitated form. Or we can also look at the use of energy in transporting it. So an active form of transport, and that we can also see. So in other words, depending on the drug that we are having, the transportation method will be chosen by the body. The body chooses the method by which it allows the drug to go. Of course, by this, the knowledge of these scientists also design drugs to have certain properties that will promote one form of transportation process over the other. Mostly, like we stated earlier, the passive transportation method is the preferred way. But if we cannot move the agent by the passive transportation method, then we have to find a way to use energy to move the agent. All right. So that is the processes by which drugs cross the biological barrier. The processes by which drugs cross the biological barrier. Now let's look at a few factors that may affect absorption. A few factors that may affect absorption. So I put them into two main groups: the drug factors and then the host factors. The drug factors and the host factors. So if you take the drug factors, we are looking at the chemical, the drug itself. What are some of the properties of the drug that will promote absorption or that will affect absorption? So the chemical structure of the drug, we said that the barrier that is being crossed is a lipid barrier, bilayer. So the agent that is more lipid soluble are the ones that will be able to cross over. So the nature of the drug, the more lipid it is, the easier it is to cross the biological barrier, or the easier it is for absorption to occur. To the molecular size of the drug, the smaller the size, the easier it is for absorption to occur. The larger the size, then we have to probably think about bulk transportation, etc. The pH of the environment or even of the drug, if each drug has its own pKa properties, so the pH. So for example, if the agent is acidic, in the stomach environment where it is acidic, the agent may be okay. But even then, depending on the exact pH, they may be affected. But what about if it gets to the small intestine, which is usually basic? Then you can have the acid-base neutralization, and then the absorption will not occur because the drug has been neutralized. The same way the drug is basic and it enters into the stomach acid, it's going to be neutralized. So then we want to know the acidity or basicity of the drug so that we can modify it as such. We also want to check if our drug is ionized or not, simply because we know that the environment in the GI tract can affect the ion charge on your agent. So for example, if you take ion 2, which is ferrous, in the stomach environment, ion 2 becomes ion 3, which is ferric. Now, ion 3 compared to ion 2 is less absorbable because of the increased charge. So, in fact, this is the basic reason why most iron preparations, especially for pregnant women, you will add vitamin C to help the patient get the drug in the ferrous form, which is the easier absorbable form over the ferric form. All right. Now, the formulation, we basically explained that when we introduced ourselves to absorption, because the route of absorption, the route of administration, the formulation of the drug will also affect the absorption. If you use a liquid formulation, if you use a solid formulation, if you use a cream, a suppository, each one will have different absorption rates. And so the formulation also affects your agent. And in the case of pills, especially, the disintegration and dissolution factors of the drug also affect absorption. How quickly is the drug able to be broken down in the GI tract before into the smaller portions for it to be absorbed? Because you take a tablet, which is a composite, and it has to be broken down so that the molecule is released to be absorbed. And that is disintegration, the breaking down of the drug, and dissolution, the dissolving of the drug inside the liquid environment in your GI tract. That will also affect your absorption. Now, those are properties of the drug that will affect absorption. Now, what about some properties in the one taking the agent that could also affect the absorption of the drug? The route of administration, whichever route you choose, will determine how quickly or slower the absorption rate will be. Surface area, the environment or the area where the absorption is supposed to take place will also affect the rate of absorption. So you take the stomach and you take the small intestine. The small intestine, having a larger surface area, will have more absorption compared to the stomach, which has lower surface area. How quickly is your GI tract moving? Someone who is having diarrhea compared to someone who is having constipation. Constipation where your GI tract has slowed down, probability of more absorption occurring in constipation is high. But if your GI tract has moved faster, as in the case of diarrhea, then the drug can go through without being absorbed. So it will also delay the amount of drugs that are absorbed. That means affecting the absorption of the drug. We also said that when a drug is taken orally, especially or the enteral route, it goes through the hepatic system, and there could be first pass metabolism, which will reduce the bioavailability of the drug. So that first pass metabolism is able to destroy some of the drug, and therefore the amount available for absorption is reduced. So first pass metabolism could affect the amount of drugs that are absorbed. The presence of food or other drugs in the GI tract can also affect the amount of agents or drugs that are absorbed. Some drugs prefer food, like riboflavin, where you need an oily meal, or artemether lumefantrine, where you need a meal. And then some also do not prefer meals or food in the GI tract. The penicillins do not prefer food, especially proteins in the GI tract. So you want to take those on empty stomach, yet we will encourage you to take riboflavin with meal. Why? Because the presence of food can affect absorption. In the same way, some drugs can affect absorption. There are certain drugs that may chelate or bind to other drugs, and their presence will impede the absorption of the other drug. Typical example is our antacids. Anytime you have an antacid in your GI tract, it will interfere with absorption. So the presence of food or drugs can affect your absorption. How much blood is being supplied to the site where absorption is supposed to take place will also affect your absorption. The more the blood flows through the area, the more absorption occurs. The less blood flow, the less the absorption. What mechanism is the body trying to use to pick the agent? If it's a simple diffusion, it's the fastest, it's quick, and it's easier. If it is an active transportation system where energy is required, we may have to go through. So depending on the transport mechanism that is being used, you could also affect your absorption. The patient's health status or age status could also affect the amount of agent that are absorbed. The aged, the older, and the very young people, babies and infants, very young people, the absorption rates may differ from the very elderly and from the middle age. So your age and then your health status may affect how your absorption may occur. Also, if there are some activity in the GI tract that could affect the drug directly, that could also affect the absorption. So we talked about the nature of the drug. For example, where acidic drugs are destroyed by the basic small intestine environment, and basic drugs are destroyed by the acidic stomach environment. There are some enzymes that can also be found in the GI tract that could destroy some of these medications. So benzyl penicillin, a natural penicillin useful for mostly gram-positive infections, is not used orally because it is destroyed by the acid in the GI tract. Insulin is also not used orally because it is destroyed by an enzyme. And so the destruction, of course, means that there won't be absorption, at least to get your quantity needed to elicit the effect you are requiring. And the pH, just like the nature of the drug, the pH will affect the drug based on the nature of the drug. So these are some of the factors that affect absorption of the drug. So with that, we come to the end of the lesson today. I hope it's been helpful to you looking at absorption. The next time we'll meet, we will talk about the second principle of pharmacokinetic, which is distribution. Thank you for your attention. Please don't forget to like the page and to subscribe. Have a wonderful day. God bless.